Today marks the start of National Nurses Week, a time to recognize the role they play in patient care every day.
Our Natalie Caranda, she's live this morning at UPMC Memorial in York County, starting her day in one of the most critical areas of the hospital. That, of course, would be the ER. Natalie, good morning.
Yeah, guys, that's exactly why we decided to start the day here. I mean, it's the place where people come in, they don't know what's wrong, or they do at times, and the nurses that are working in this department are the first ones to step in and figure out what's wrong, which is why we're in here to start, but we're also throughout the morning going to be showcasing some different roles that they play in this hospital, because there are so many. I don't think a week is enough to celebrate and recognize all the hard work that they do. So to get more into why we're standing in this room and some other things that they have to offer, I'm going to bring in Taylor, who has been a nurse for 8 years now. Yes, good morning, Taylor. Talk to me. What does this week mean to you? How does it make you feel being on the front line every single day?
So being on the front line, I like that I'm able to interact with the patient when they come in. You never know what you're getting, especially in the ER. It could be a difference in somebody's life as life or death, or just somebody's in pain. Some people it's mental health and they just need somebody to talk to. So you're the first face they see. You get to interact with them, be able to help them in different capacities.
And it's not just one face that they're first walking into. You were just telling me how you guys work as such a team here.
Yes, there's many of us that come together to make everything run fluently in the department for different aspects. We have techs, we have physicians, we have nurses, and then everybody just works so good together as a team that you get a patient and there's 3 people in the room getting that patient settled, getting everything they need to get their care started.
Well, Taylor, speaking of this room, you wanted to show us something that is right behind, that is kind of the first thing to greet, you said cardiac arrest patients,
yes,
right whenever they walk through the door.
Yes. So normally this is one of our trauma rooms that we use, and when we know we're going to get a cardiac arrest, we come in and we're in the room waiting for the patient. That way we can start care immediately. So we use these crash carts are in every room, and we have something called this Zoll. Sorry. And we'll when a patient comes in, we'll hook them up to this Zoll, and essentially this allows us, all of us ACLS trained nurses, to interpret what the rhythm is as we run the cardiac arrest. It'll show us on here what their rhythm is, and if it's a shockable rhythm, we're able to then deliver a shock. If they need cardiovert it, we can cardiovert them. If it's somebody that comes in with a low heart rate, we're able to pace them and increase their heart rate.
So it's a pretty quick process from the moment that person comes in to the moment you get them onto this machine.
Yes, because in general, running a cardiac arrest, the less time spent off the chest is the less time that a patient is receiving oxygenation. So,
well, Taylor, thank you so much for showing us, such a crucial part of, the equipment here, and also talking about the team as well. I'm excited to learn more about everything in this room that we're standing in, but we'll come back to you later this morning. Like she said, they work as such a team here, and it is all about celebrating them throughout this entire week until Monday. The whole National Nurses Week is recognized. And James and Gabby, learning about this machine just a little bit ago, it was really cool, and it's also nice to hear that they are celebrating as a team this week. It's amazing what they do here.
It really is, and it's nice to see the behind the scenes as well.
Oh, it's always good to get a look behind the scenes. A bunch of my friends are nurses. They work so hard. The hours very demanding, high pressure, so we should have way more than a week for them, but I'm glad we can celebrate them now.
Me too. Natalie, thanks so much. We'll check back in with you soon.